Hello everyone. Today we are going to discuss MCQs on the topic of surveillance, and this information is useful for education and staff training. Question number 1. What is the primary purpose of infection surveillance in healthcare settings? So we have 4 choices. A. To monitor staff performance. B. To track antibiotics prescriptions. C. To identify and reduce healthcare associated infections. And D. To report financial data. We are going to wait for a few seconds for the correct answer. And the answer is C. To identify and reduce healthcare associated infection is the primary purpose of surveillance. Question number 2. What type of surveillance involves collecting data on all infections in a specific patient population or unit? A. Targeted surveillance. B. Passive surveillance. C. Active surveillance. And D. Population surveillance. And the answer is C. Active surveillance. Active surveillance includes proactive collection of data such as reviewing charts, lab results, and visiting wards. Question number 3. Which of the following is an example of targeted surveillance? A. Monitoring all patients in the hospital. B. Monitoring surgical site infections in post-op patients only. C. Monitoring staff hand hygiene across all units. And D. Monitoring antibiotic usage hospital-wide. And the answer is B. Monitoring surgical site infection in post-op patient is an example of targeted surveillance. Targeted surveillance focuses on specific procedures, organisms, or units. Question number 4. What is the main difference between active and passive surveillance? A. Passive surveillance is more expensive. B. Active surveillance requires lab confirmation. C. Active surveillance involves actively seeking data. Passive relies on routine reporting. And D. Passive surveillance is illegal in most countries. And the answer is C. Active surveillance involves actively seeking data. Passive relies on routine reporting. Question number 5. Which healthcare associated infection is most commonly tracked through surveillance programs? A. Tuberculosis. B. Catheter associated urinary tract infections. C. Influenza. And D. Common cold. And the answer is B. Catheter associated UTIs is most commonly tracked through surveillance programs. Question number 6. Which department is primarily responsible for conducting surveillance in a hospital? A. Human resources. B. Public relations. C. Infection prevention and control. And D. Diagnostic imaging. And the answer is C. Infection prevention and control. Question number 7. Which of the following would be considered a surveillance indicator? A. Number of beds in a hospital. B. Infection rate per 1,000 patients day. C. The cost of antibiotics. And D. Number of staff per shift. And the answer is infection rate per 1,000 patient days. Question number 8. Why is standardization important in infection surveillance? A. It makes staff training easier. B. It helps in comparing data over time or between institutions. C. It ensures antibiotics are used correctly. And D. It reduces staffing needs. And the answer is B. Standardization is important because it helps in comparing data over time or between institutions. Question number 9. What role do laboratory results play in infection surveillance? A. They are used only for billing. B. They confirm the presence of specific pathogens. C. They determine staff schedules. And D. They are not relevant. And the answer is B. They confirm the presence of specific pathogens. Question number 10. What is the first step in starting a surveillance program? A. Reporting findings to the media. B. Choose antibiotics for all patients. C. Define goals and objectives. And D. Hire more nurses. And the answer is C. Define goals and objectives. So that's all for today. Thank you for joining me.